Hello, I'm Bob Ladd, and I'll be presenting Botella et al.'s study, In Vivo versus Augmented Reality Exposure in the Treatment of Small Animal Phobia. This study exposed a total of 63 participants who met the DSM-5 criteria for specific phobia, small animal subtype, to either in vivo or augmented reality exposure to either cockroaches or spiders. Traditional behavior therapy and VR therapy had previously been shown to be effective, but the authors noted a reputation problem around in vivo exposure and an uncertainty if VR could be as effective. The goal of this study was to see if exposure in VR was significantly different in effectiveness than more traditional behavior therapy. Participants were randomly assigned to one of two conditions. The behavioral avoidance test, a common behavioral assessment tool, was used to score anxiety and avoidance before and after treatment, as well as 3 and 6 months post-treatment. Participants also completed multiple questionnaires and a few other diagnostic assessments of anxiety and response. The augmented reality group was placed in a VR system that closely modeled the movement of real spiders and projected them into the physical space that the person had occupied when they were not in VR. There was no tactile stimulation, so that is a way that the VR condition differed from the in vivo. For both conditions, participants went through only one session that could last up to 3 hours and progressed gradually through exposure to feared stimulus, beginning with being in the same physical space but not contacting, and ending with direct physical contact with the feared stimulus. This is demonstrated by a progression through a series of rooms. And so in our first room, we are separated by a wall of glass from the spiders, so there can be no physical contact. This mirrors Botella's initial condition, but the feared stimulus is present in the space. In the second condition, the feared stimulus is present in the same physical space with nothing separating, but it's a fairly large space, and so a participant would be able to move around the room and avoid them. Also, some of the spiders in this condition tend to move towards the upper corners of the room, and so even if the person was feeling particularly brave, they might not be able to contact the spiders in this condition. In the final condition, the spiders are in a more confined space and are pushed towards the participant, and so it might be difficult to avoid them even if one wanted to. This mirrors Botella's final condition, in which participants actually contacted the spiders. If the spiders were not pushed in the proper way, then the participant could directly contact them at the urgings of the physician. The study found that the treatment was effective for both conditions and also at the 3 to 6 month follow-up. Additionally, most participants had clinical meaningful improvements at these check-ins, as measured by the diagnostic test. There was no statistical significance between VR and in vivo. Participants in both conditions evaluated their level of exposure positively, while augmented reality participants indicated that they felt they had a less aversive experience. Those in vivo also rated that their experience was more useful for their problem. Both of these ratings were given to everyone, and there was a statistical significance difference between the two styles, but an actual aversion and fear response and improvement over the long term, there was no statistical significant difference between VR and in vivo. As a direct exposure to the feared stimulus has a bad reputation, using augmented reality instead, as it is equally effective, could be more accessible and less daunting for individuals. This study supports the use of augmented reality as an effective treatment method.